I'm Dr. Jeff Kieliszewski, forensic psychologist. Before I get started today, I want to offer a warning. Today I'm going to talk in depth about intimate partner violence and domestic violence. I'm also going to use some examples from a case where I recently testified where a child was murdered. So you're going to hear some disturbing things today and maybe some things that are not easy to hear, particularly if you have your own trauma history, so please be forewarned. A few weeks ago, I was called to testify as an expert witness in a child murder case. It was a terrible case where the boyfriend of the child's mother brutally murdered the child in front of the mother. The boyfriend was charged with murder and eventually convicted. He was sentenced to 55 to 90 years on a second-degree murder charge. Now, the mother also faced criminal charges in this case because this is a situation where there was a lot of domestic violence on the mother, and the boyfriend repeatedly physically abused the child. The mother faced charges based on the argument that she did not tell anyone about the abuse and that she did not intervene on the abuse of her child, and therefore she shared some culpability in the child's death. One of the things I was asked to testify is why would a person stay in a domestic violence situation even when her own child was being abused as well? And why, given the clinical picture and the circumstances, did she not tell anyone? Did she not contact authorities about what was going on? So that brought in the science and the research on this question: why do victims stay in domestic violence situations? And if you notice, when I talk about this issue, I will use her, because frankly, the bulk of the research that's examined this issue examines male on female intimate partner violence. By the way, by mentioning and talking about the case I testified in, I'm not violating any confidentiality. I testified in a public hearing and my report was submitted into evidence. So the things I'm saying today are already in the public record. Now, science has examined this question: why do victims stay in domestic violence situations? Because there is a phenomenon of people not leaving these abusive relationships. And perhaps you've read about or heard about cases like this. And a lot of times, unfortunately, you'll hear about this case when someone didn't leave and they were eventually killed. Now, although situations where there is intimate partner violence can differ, the research found some common or frequent reasons why people remain in these abusive relationships. Number one, shame, embarrassment, or denial. In these types of situations, the victim may feel a lot of shame or blame herself that this abuse occurs. And denial often involves minimizing the abuse. Sometimes in these situations, people do not want others in the community to know what's happening behind their closed doors. The second thing that they found in the research is that oftentimes the abuser will exert pervasive control over the victim. In many cases, the abuser may have control over the victim through social isolation. In fact, this is a pretty common technique that abusers will use. So it's not uncommon for the abuser to separate or isolate the victim from social supports. The abuser may also exert logistical control by not allowing the victim to have a cell phone, to not allow the victim to have keys to a vehicle, money, or even allow the victim to leave the house. Now, in the case that I testified in, the victim and the abuser lived in a rural area, and she had no access to a phone or a car, and there were no close neighbors. In some of these cases, you'll see that the abuser exerts control over other things as well. For example, food. The case I was involved with, there was a lock on the refrigerator. The abuser controlled food. Sometimes what the person will wear, when they will sleep. Another reason that was found in the research were what were termed pragmatic or practical reasons. Now, this can occur if the victim does not have any means for financial independence. And in some cases, the victim may not speak the language of the locale and is completely dependent on the abuser. Also, some victims are concerned that if they report the abuse, they're at risk to have their children removed by a social service agency. Some victims may be immigrants that are here illegally and may be afraid of being deported if they report the abuse. And then there's a case where some victims stay in the relationship in order to protect their children from abuse at the hands of their own abuser. Another reason we find is trauma, psychological impairment, or substance abuse. Now, in the research, we see it's not uncommon for people who end up staying in these situations of intimate partner violence that they may have already had a history of being abused, and some may be suffering from post-traumatic stress disorder. Now, based on previous experiences of abuse, oftentimes these people are more apt to just try to cope with the abusive situation rather than try to change the situation or escape. That's what they did in the past. And sometimes the victim may be involved in abusing substances as a way to cope with the abuse that's occurring. And as a result, they're not able to gather themselves or organize a plan to escape. In the case that I testified in recently, the victim already had a history of PTSD. And she often just tried to cope with the abusive situation and get through it rather than trying to change the situation. Also in that case, the abuser forced her to use drugs. Now, I've seen that in domestic violence cases before, the abuser forcing the victim to use drugs. And it was to the point where, in the case I testified, the person at times was impaired and sometimes even incapacitated due to the drug use that was forced upon her by the abuser. Another factor that they found in the research is trying to leave that domestic violence situation or telling people about what's happening can be more dangerous. It's not uncommon in these types of situations where someone is experiencing intimate partner violence that they fear that their partner could become even more violent. In a case I testified in, the abuser told the victim that if she told anyone about the abuse in the household or tried to leave, that he would kill her 3-year-old daughter, she would never find the body, and he would shoot it out with the police. Now, in that case, this guy wasn't just running his mouth. He often told the victim this was his plan if she disclosed what was happening while holding a gun to her head. In 1979, a psychologist named Dr. Lenore Walker received a grant from the National Institute of Mental Health to look into this issue, why victims of intimate partner violence don't leave these situations. The factors I outlined above were some of the factors that were identified in the research. Dr. Walker also identified something called the cycle of violence in these types of situations to help explain the dynamics that occur in intimate partner violence, and also how victims are psychologically manipulated by their abusers. As a result of her research, she put forth a theory pertaining to what she termed battered woman syndrome. Now, more recently, that term's been adjusted to battered person syndrome because it's been used in cases where the victims of the violence are men. Now, battered person syndrome is broadly defined as a psychological condition that can develop when a person repeatedly experiences abuse, usually at the hands of an intimate partner. It's been argued that this is a potential subcategory of post-traumatic stress disorder. And several of the characteristics of battered person syndrome are similar to PTSD, but it also includes a couple of hallmark characteristics or distinction. In battered person syndrome, there seems to be this powerful cognitive distortion where the victim will blame herself for the abuse. Also in battered person syndrome, there's a strong sense of what's called learned helplessness in the victim. Now, learned helplessness is a well-researched psychological phenomenon where an individual feels powerless to change their situation due to repeated intense trauma. Now, this idea of battered woman syndrome has been used as a legal defense in some highly publicized cases you may have heard of. And these are typically cases where the person who faced repeated intimate partner violence ended up killing their abuser. Legally, the outcomes in those cases, it's sort of worked to help the defense. Sometimes it's and sometimes it's not. So this topic of why people stay in relationships where intimate partner violence is present can be quite complicated. We just sort of scratched the surface on the research. Now, fortunately, the research that was done or has been done is a quite sizable body of research that addresses the topic. And the research that's done on this topic tends to be very practical research. And what I mean is it's easy to apply, and it has impacted public policy, mental health treatment, and the criminal justice system. Thanks for tuning in today. If you have an interest in forensic psychology, subscribe to this channel. Also, pass this link along to others who may have similar interests. I'm also on other social media outlets. Everything is under Dr. Jeff Kieliszewski, forensic psychologist.